Okay. So the next set of disorders that we're going to be covering are what's called psychotic disorders, and it's usually the kind of disorders that we most commonly think of when we think about psychological disorders. But I kind of want to differentiate psychotic disorders from the stress disorders of anxiety and PTSD, and the mood disorders of depression and bipolar. Okay, with anxiety, with stress disorders and depression disorders, there is a placement within reality that those symptoms are taking place. So even though we can have anxiety symptoms with no known triggers that are there, the symptoms are physiologically manifested and are realized. Okay. When we talk about psychotic disorders, what we're talking about is breaks from reality. Okay, so things such as delusional thinking and thinking, I'll talk stereotypically that there's aliens that are trying to suck my brain out, so I put tinfoil over my head. That's kind of a stereotypical kind of description, but it kind of gets a point. And there tends to be a lot of things like hallucinations, auditory, visual, those types of things, which we'll get to. And then there is usually some type of disorganized thinking. People aren't able to kind of quote unquote think straight. They have their thought processes go from one topic to the other almost very randomly. Okay. And probably the first psychotic disorder that is probably most well known, kind of like with dementia, everyone associates Alzheimer's. In fact, people don't. A lot of individuals don't realize that Alzheimer's isn't actually the leading type of dementia. Alzheimer's is a type of dementia, but it is not one of the leading causes of dementia. There's other disorders that take that forefront. And schizophrenia often is assumed to be the psychotic disorder. And as we will see, there's actually a few others to look at, but this one is the most kind of well-known, the most stereotyped within popular media and film. So this is a good one to start with. So the question becomes, what is schizophrenia? And this is really kind of, if we look at this, really makes what we see as this breaks from reality. Okay, is for diagnostic purposes, you have to have two more of the following: each present for a significant portion of time during the month period. Okay, and again, you'll see, we'll get into this. A lot of these things could occur due to drug use and substance use. Okay, and that's a very important thing to say. And there's also some sleep disorders that can kind of cause some of these things as well, because the thing that we should state about schizophrenia on the onset is the one thing we know that is going on in the brain is a large overproduction of dopamine. Okay, the brain is basically marinating in the stuff. Okay, and while on dopamine is our motivational pleasure type of hormone, when it is there in excess, it can create things like delusions, hallucinations, disorganized speech, catatonic states, and negative symptoms, as well, as we'll get to. And when we think about things like methamphetamine, cocaine, those stimulant type drugs are often associated with delusions, hallucinations, disorganized speech, and these type of symptoms. So kind of keep that in mind. When we look at criteria one, which is delusions, they come in kind of basically two types of categories. The belief that there is something going on, such as a conspiracy, that the government is trying to put computer chips in each one of us, or something like that, or that aliens are among us. Those kind of, and I want to state this. This goes beyond conspiracy theory type of individuals. Okay, this is a true, hardened, 110% belief that the government is trying to put in computer chips and that aliens are trying to take over the world, those kinds of things. Okay, that's one type of delusion, and it's a very common delusion among many schizophrenics. The other type of delusions are delusions of grandeur. So, there are schizophrenics who feel that they're Napoleon or Jesus Christ or those. So it's a delusion of grandeur. But there's also delusions of deprecation, that I'm worthless and I'm not good. And that's one of the more common type of delusions rather than delusions of grandeurs. Okay. Hallucinations. Hallucinations are sensory experiences that are not physically present. So probably in the movies you've seen, hearing voices, visual hallucinations. Those are not the most common type of hallucination among schizophrenics. Tactile, feeling like people are poking you or something like that, and olfactory, smell, are the most common types of hallucinations. Now, I should say there has been incidences where people thought, oh, that person is just being schizophrenic. So I just want to put this out there. There's one auditory hallucination that if you're having, you need to get medical attention right away. If you smell bacon and bacon is not present, you need to go to the hospital, because that usually is a sign that you're having an aneurysm in your brain and it's about to blow. So one olfactory hallucination that is very associated with aneurysms and strokes is the hallucination of the smell of bacon. So just something to keep in consideration before you diagnose yourself with schizophrenia. Disorganized speech. We're going to watch a video here in just a minute that's going to really emphasize disorganized speech, but it's frequently a derailment of some story, or it's very incoherent. And we'll see this in the video that we'll watch here in a few minutes. And by the way, while we're doing this, if you'll please write down these 5 criteria, because we're going to watch a video here in a minute, and I want you to pick out this individual's delusions, hallucinations, the disorganized speech, the gross disorganized or his catatonic behavior, and some of the negative statements that he makes. So please make sure you kind of jot these down as we move forward. I should have said that before I got started. Grossly disorganized or catatonic behavior. One of the ways that schizophrenics often alleviate their symptoms is through smoking. And in fact, this is one of the few disorders where a doctor will recommend that the individual keep smoking and not stop smoking, because for some reason the nicotine has a dampening effect on the intensity of symptoms for schizophrenics. And again, in this video we'll watch, you'll notice that the individual, you usually call them chain smokers, but he'll have a cigarette in both hands and trying to light another one with one in his mouth. Okay, that's kind of that grossly disorganized type of behavior. The other thing that we often see, especially when there's a severe stress response for a person suffering from schizophrenia, is something called a catatonic behavior, or catatonic state. And what a catatonic state is if you've ever been to a wax museum and you see the wax statues, That is a kind of a visual representation of someone in a catatonic state. When I did clinical stuff and whatnot, I had the opportunity to go to a inpatient hospital where they treat schizophrenia, and if a person had his hand out in a catatonic state, you could lift it up, but as soon as you let go, it would go right back into that immediate position that it was in. Now, that's an extreme catatonic state. It's always on kind of a frequency. Remember that all these disorders we're talking about are on a continuum. So there's low symptomology of schizophrenia, and then there's full-blown catatonic states. In some situations, a person can become partly catatonic, where maybe they can't move, for example, their legs or their hips. So, most of the time, what you see is people in a catatonic state in their face, and that they can move their body, their arms, and their legs, but their face seems like it's been frozen in time. And so that's something to know about. Okay, and then negative symptoms are, again, becoming very emotionally withdrawn and almost like the person is not there, or it's inappropriate type of statements. And again, you'll hear in this video, the individual gets asked, what do you like, or what do you need more of? And the individual makes an inappropriate statement. That's an ovulation of a negative symptom, and you'll hear what his response is. Okay. All right. And so that's criteria A. We have to have at least 2 or more of these symptoms for a significant period of time. And again, I'll say across situations. And then the next criteria is for a significant portion of time, the level of functioning in one or more major areas, such as work, just like the other disorders, that there has to be a disturbance in the ability to function in the world and take care of themselves. Okay. So again, really quickly, I'm just going to give you a minute. Write down these first 5, and then in the video we're going to watch, I want you to determine each of these symptoms for the individual that we're going to watch. And then what we're going to do after the video is we're going to come back. I'm going to put you in small groups, and I want you to collaborate on what you found and what you saw. And then we'll come back to the class and report out what we found. Okay, so I'm hoping everybody has that. So it's delusions, hallucination, disorganized speech, grossly disorganized or catatonic state, or negative symptoms, meaning negative expressions, either not to the point they should be, or overdone or inappropriate. Okay. So we're going to go ahead and we're going to move forward. So this is one of my favorite guys. His name is Bob. So let's watch this video, and again, determine the symptomology. When we come back, we'll break into small groups. I'll give you a few minutes to collaborate, and we'll come back and see what y'all came up with. Okay?
Years and 6 months, respectively. This is a new bike. Dad tried to sway my eyes when I was depressed. Tried to put a bike in here so we could get some life, you know. And this is a radio, cigarette case, and the holder in ashtray, and this is a TV.
Could you tell me about the trophies? Are those things you've won?
I was an excellent bowler and a Latin scholar in high school and college. This I got from Nelson Burton Jr., an average of 195 in bowling. This was from the Forensic League. Seal of approval.
Bob was once the captain of his high school's debating team. He now experiences extreme thought disorder and talks in a disconnected jumble of words.
I know how to angle myself with the rest of the men, do you see? That's why I did that to Sue. That's why I did that to Aunt Ethel, you know. And I wanted Fritz and all of them to know, the praying mantis and the spider and the grasshopper, to know that I think it's very important that we act badly, but I think it's very important that we act in reality of what makes the world go round. You know, you're liable to go sliding off the curb into your death on a man that can't control himself. So really, the endless wins, whether it's no or yes. So I think bulk sometimes wins. In some of the cases, you know, the very agile cases, the bulk wins. But I think the most important thing the devil can do is to self-sacrifice and coordinate the Kmart walk so pleasure can be evened out. And in fact, I've really swayed my charms towards going forward into straighthood. But I think every doctor knows if there's no such thing to believe in straighthood and to go ahead forward into kidney stones and stuff like that, you know, Dad's a son of a bitch. But
Bob, do you know how long you've been sick?
about a year.
Just recently?
No, it's been about a year and 2 months.
Bob doesn't realize he's been sick for 17 years.
Could you give us a little bit of a description of what Bob was like as he was growing up?
Yes, Bob was a very serious person from the first day he was born. We thought surely he was happy. He had just about everything. We spent a lot of time with him, and we loved him very much. This was our first child, and we had a lot of hopes and expectations of Bob, because he was a very smart fella, and his coordination was great in sports. He liked government affairs, he liked politics and the like. As I say, he excelled in math. He had 4 years of math in high school. He accepted the responsibilities of his homework on his own and did a bang-up job. He was an all-American boy.
On the advice of a private psychiatrist, he said that he felt like he needed...
In the beginning of Bob's illness, doctors advised his parents to commit their son to a state institution.
I think that
Bob's mother talks about why she decided instead to take care of Bob at home.
he was in that state hospital for 6 months. And it was just terrible to see what happened to him. And when I saw him, I couldn't believe that this could happen to this kid that had been such a great kid. He was he was so thin, he could hardly keep his shoes on. He shuffled, he could hardly walk. And he was just so drugged.
You just had to take him by his hand, you know, and lead him.
And
he was that bad off.
like a little puppy or something. It was terrible. And I said to Cappy, I'll see this child dead before I'll ever let anybody do anything like this to him again. And we brought him home.
You won't have to have a second piece. Yeah.
Bob, do you want to return thanks for us this evening? Okay.
Our dear precious London-town man, we pray that you will please forgive the sins of the states and take us to the lasagna dinner. We pray that you will bless our loved ones for hearing and seeing and smelling purposes. We pray that you will also let us go east, and we ask these things in Christ, the Messiah's name, and for his sake. Amen.
Okay.
After dinner, Bob's mother, Frankie, talked about her son's childhood and how he first got sick.
I hope it is.
Bob's was a typical case. Schizophrenia struck him at age 18, during his first year of college.
And it came on suddenly. It was, he was in college, and we really didn't recognize it. He came home at Thanksgiving, his first semester in college, and he was nervous, but we figured, you know, it's just college. And then when he came home at Christmas, he was kind of pacing and walking the floor, and we still didn't recognize anything, just thought he was eager to get back to school. And by mid-semester exams in January, he was calling home 2 and 3 times a week, a little before that. And then he got to where he was calling home 2 or 3 times a day, and then 4 and 5 times a day, and then in the middle of the night he'd call and talk an hour, always to be reassured. And we could not understand this. We just didn't know what was happening. And finally, on Thursday, before his final exam started on the following Monday, he called and he said, Mom, my mind is going. I'm losing my mind.
Are there some things you'd like to do?
Yeah,
What would you like to do?
most of anything. I'd like to, I was going to say screw them. Be with the Cowardly Lion.
And the following September, he was hospitalized for the first time. He was in a private hospital, and he was in there for about 5 weeks. And that's when they started giving him Haldol. And then we saw the reports at the plant where my husband works, and that's when we found out what he had, was through the insurance papers, and on there it said acute schizophrenia. And we didn't even know what schizophrenia was. Well, of course, now we know it is a disease, but back in those days we didn't know this. And that's very hard on the parents when they learn, when you have a doctor telling you because of something you did that child is ill, and it's not true.
Scientists and doctors do not know what causes schizophrenia.
Is an encephalogram.
There are several theories for the onset of the illness. Schizophrenia often runs in families, and it may be inherited genetically. Yet, as in Bob's case, there is no history of mental illness on either side of the family.
I think those bats and the witch and Cliff were really my father, but the Tin Man wouldn't let me date my father. Too big, you know.
Some scientists believe in biochemical theories, that there is something wrong in the metabolism of the brain.
So, I think the monkeys and the men are mixed.
Some doctors believe that viruses attack the brain, possibly during the pregnancy. Abnormalities in a person's immune system, developmental theories of early brain damage, even stress theories in which a person goes mad because he cannot cope with the pressures of his life. But all of these are just theories. Schizophrenia is not curable because no one really understands what causes the illness.
I think we need to fly over the Atlantic Ocean. That's what we need, yeah.
You feel more like doing something?
Oh, yeah.
Bob's father, Cappy, decided to retire early to devote more time to his son's care.
But I think as time goes on, it's smart to lay off medicine.
You don't like to take the pills? You think you could ever get much better if you don't take medicine?
It just depends on how I could hit the golf ball.
One of Bob's symptoms is the need to walk, to release his excess energy. Bob once walked out the door of his home in West Virginia and was found by the police several days later. He had walked all the way to New Jersey. And so every day, 3 times a day, Cappy drives his son to a shopping mall. The Kmart is Bob's favorite place to go.
Hi.
Oh, Bob.
Yeah.
Are you just walking, or are you?
You know,
shopping?
I just love to shop.
Don't let us hold you up.
As Bob walks, he constantly hears imaginary voices, perhaps the most dramatic symptom of schizophrenia. He hears these voices as clearly as he hears the voices of real people talking to him.
Are you going to still stay around here? Want some hot chocolate?
Bob can't control or stop these voices, which always torment and criticize him.
So how you feeling, Bob?
I just had to claim life.
What's that?
Had to claim life.
Claim life.
Yeah.
What do you mean by that?
You said that I have never been a man in my life, therefore I have to claim
no,
life.
I didn't
Yeah.
say that.
Oh, okay.
I wouldn't say that.
Okay.
You'll be a man.
You'll be a man someday.
Bob is one of the 40% of schizophrenics that don't respond to any drug treatment. He's been given Thorazine, Stelazine, Haldol, Moban, L'Occitane, Prolixin, Mellaril, and Navane. But none of these antipsychotic drugs have made Bob any better.
Oh, he tells me to buy drugs.
Bob is about to start taking an experimental new drug called clozapine. It's considered a last hope medication for schizophrenics who have failed to improve on all other drugs. But there is some risk in taking clozapine. The medication can, in some cases, have dangerous and even fatal side effects.
We want it to work so badly, but yet you always have to remember it may not help Bob, it may not help Bob, or he might develop the side effect and not be able to take the medication. If he can just be happy and have an attitude of just wanting to do something or wanting to go to school or even being able to watch television or just be better than he is, you know. This is just a wasted life. It's not only wasting his life, it's wasting ours. It's
I don't know. I just have a feeling about this one thing that it's going to help. It's got to help.
We can't imagine waking up in the morning and not having this sick kid. I just can't imagine what it would be like. So we are really looking forward to it. It's hope. It's a lot of hope. And
Bob didn't get better. His thinking started to improve, but he had a bad reaction to clozapine and had to stop taking it. Bob lost his balance and coordination, and today cannot stand up or walk. After struggling with the illness for 17 years, Bob's mother and father finally decided to commit their son to a small group home, where Bob will receive the intensive care he needs.
Okay, everyone. So that is the story of Bob. And I think what we should do is I'm going to just say a few more words, but I noticed that there was some connection issues with a couple of you in the room. And so what I'm thinking is I want to make a few comments about Bob and his situation. And then what I'm going to do is I'm going to post the video on Canvas with the 5 diagnostic criteria. And if you were one of those who was having trouble coming in and out, please go review that and identify the 5 diagnostic criteria that you see in Bob. And then on Thursday, we'll come back, get in a group, little groups, and then we'll discuss it after that. But at this point, what I'd like to say about Bob is that he is what we call dysfunctional schizophrenia. Just like bipolar, there's type 1, type 2. Schizophrenia is kind of the same way, but what I'd like you to think about it is on an autistic scale, from being functional to non-functional. Okay, functional meaning that you can hold a job, you can live independently, you can do all of those things appropriately. Non-functional is that you have to have major assistance in living, such as Bob. Okay. Often the difference we see between an individual who has functional schizophrenia and non-functional schizophrenia is the age of onset. Individuals who tend to become functional tend to get diagnosed or have the symptoms very early in childhood. In fact, while it's hard to find the evidence, it seems like there's a small portion of individuals that might be born with schizophrenia, but it's really, really hard to assess in infancy and early childhood. But we do know that there's children who develop it at a very young age. And what that does for that individual is they go through their developmental stages with their symptoms. So they learn how to cope and manage with them. And so they tend to be much more functional in life. If we have time on Thursday, we'll watch a video on a young lady who has a functional schizophrenia, and you'll see that the onset was very early in childhood. Individuals who have non-functional schizophrenia, the schizophrenia usually was a late onset. Normally, as this video says, at around the age of 18, a little bit more, it seems to be associated with. Yes, well, Trini, acute schizophrenia is when a person has a temporary episode. So acute schizophrenia is when an individual does not have the disorder for a long period of time, but it comes and goes in acute phases. But yes, they tend to be functional schizophrenias in that area. So you are correct on that. People who have acute schizophrenia, so this means that they may have onset of symptoms for 3 or 4 weeks, and then they might go a year or two without any symptoms, and then they'll have it again. Okay. But what we do know about acute schizophrenia is they have to be able to identify when they're going through that phase in order to be adaptive to it. I worked with a couple acute schizophrenia when I did community work, and if their symptoms were not being managed well when they were going through that acute phase, they would disappear for 4 or 5 weeks, and no one would know where they are, and then all of a sudden they would just appear again, usually because of their delusional thinking. Sometimes their hallucinations motivated them to do that. But yes, you are correct that yes, they can be. But there's also functional schizophrenias where the symptoms are continually there, but they developed with them through childhood. So thank you for bringing that up, for sure. Non-functional, again, it tends to be late onset, and also acute schizophrenia can be late onset as well. And this is what creates a situation in that where they tend to just disappear for that time period and then come back, or they become very destructive in their household for a while, is that late onset as well. But what these individuals is that late onset schizophrenia can become manageable if the symptoms are caught early on. Okay, they may not. They still may need some assistance, but the earlier the symptoms are caught and treatment is implemented, the better off the individual is. When I worked at a college behavioral health center, I always expected around the 2nd to 3rd month of the semester from the dorm kids, a few of them coming in and going, "Dr. Peterson, I think I'm going crazy. I'm seeing or hearing things that are not there. I can't think straight. I can't, and there we have the start of the onset of these symptoms. And the earlier we could get them into intervention, the better off they were. And even some of them were able to finish their college education. So that's kind of the difference between it and Trinity. Thank you for bringing up acute schizophrenia, because it is a disorder that can be there consistently over time, or it can be one that the symptoms show up and then they go away and then they show up again. So I appreciate you bringing that up. The other thing that was mentioned is his non-responsiveness to medication, and the last one that he took. Here's a good place to put in a kind of you remember I said in the beginning that one thing we do know about schizophrenia is it's an overproduction of dopamine. Okay, so many of the medications that are being used are to bring down those dopamine levels. But you have to play a fine line with this, because Parkinson's disease is associated with low levels of dopamine and acetylcholine, okay? And so for many schizophrenia, and this is in Bob's case, this is kind of what happened to him, is that medication, when they say he had a bad reaction, that medication took his levels of dopamine down low enough that what he was experiencing with not being able to walk or coordinate is he was starting to develop symptomologies of Parkinson's disease. So there's a fine line and decisions people have to make when treating people with schizophrenia and Parkinson's disease. Because with schizophrenia, there's a chance that you're going to trade one disease for the symptoms of another disease. And the same thing with Parkinson's. When a person with Parkinson's is over-medicated, and that was original assumptions, well, if they're not responding to the treatment completely, keep medicating them. And what we found with individuals who suffer from that disease is they started to get the symptoms of someone who has schizophrenia. So they started having delusions, hallucinations, and those things. So with these two disorders, there's this trade-off about the side effects on both ends, okay? Okay, so I think what we should do at this point, so that people who cut in and out of the Bob video, is I'm going to have us get off of here for now.